So when people say to me, I don't know what I need, I just want to soften these lines, if they are lines from repeated expressions, particularly the ones we don't like our frowning.
Yes.
If I soften your movement, you will stop etching in those fine lines, and the fine lines you have fade. I'm Dr. Ann.
And you are watching Face the Expert, where we are going to be talking about the most common questions in the cosmetic medicine and skincare industry. Today, Dr. Ann, it's our first video.
I know, so forgive us if this might not be the most streamlined video in the world.
It's just two gals chit-chatting about
very organic.
Yes, the things that we love. Okay, so because this is our first video, I feel like we should start with probably the most common question that you hear in your clinic. Even myself as an esthetician, I hear it all the time, and it's questions about Botox.
Oh yeah, Botox. So I like to joke with my patients, except it's not a joke, that Botox is a gateway drug.
Yes.
And what I mean by that is it is safe, it is reliable, the results are very consistent. There's really an art to doing Botox well for patients. And then once you love it, which you will, then you come a few times a year to see me, and then other questions arise, and you just have that contact point. So love it, would not want to be without it.
I think it's one thing I will never probably live without. Now that I started, it's kind of hard because you look so good that you're like, I don't think I could ever not have it.
And if you look at both of us, you can look really natural. We both have it.
Yep.
But we can still move, we can still emote.
Yes, yeah, absolutely. And so the first question is, what is Botox exactly?
Okay, so it's a scary word, but Botox is one of the neurotoxins, and now there are 4 on the market. Botox got there first. Allergan got there first. It is the best known, it's the best studied, and it just has that name brand recognition. So I would say probably 95% of my patients use Botox.
Okay.
What we mean by neurotoxin is this is it's a toxin used as a medication to control muscle movement. So when people say to me, I don't know what I need, I just want to soften these lines, if they are lines from repeated expressions, particularly the ones we don't like our frowning.
Yes.
If I soften your movement, you will stop etching in those fine lines, and the fine lines you have fade.
Okay, interesting. So then, obviously, it's not like a permanent solution. How long does Botox usually last? How long does it stop that movement?
That is a good question. So in some cases, I'm not trying to stop movement at all. I'm just trying to soften it. There is a dose-dependent relationship. So, for example, I really like people to be able to lift their eyebrows up. I hate the flat, frozen forehead look.
I love it.
And yes, some people love it. I do not like it because I'm a big emoter.
Yeah.
The less you do, the more muscle movement you leave behind, and the sooner that muscle movement comes back to full function. So what happens is your body is able to metabolize away the area that the Botox is bound to. It's perfectly safe. It's not going anywhere else, but you will all of a sudden be able to gradually move again. And generally that's around the 3 to 4 month mark. That is the standard. I am trying to dose people so that they do not have to see me more than quarterly.
Sure.
Even though I love them, that is very obnoxious to have to see me more often.
Yeah.
The really lucky ones might get 4 to 6 months on that range. But I would say I like people to know the worst case scenario, which is every 3 months they might be coming back to get just a little bit more.
And I find that I get so used to not having, I have really deep 11s is what the people might call it.
Isn't that hard to imagine? She has really deep 11s.
I'm very expressive too, but naturally I have really deep 11s, and I notice that at the 3 month mark, even if it's not that bad, it's much better than what it is naturally. If I start to see it, then I just want to get back to not having it again. So I think you get used to wanting it completely gone. But but definitely it's better than what it naturally is at 3 months.
And it's funny because I started having Botox in 2008 and have not stopped. But what I notice, I use Botox, of course, to soften lines, but also to lift my arches a little bit.
Yes.
Because my natural eyebrow height is low.
Sure.
And my eyelids are naturally hooded, which you can't tell because I have Botox. So I control my arch just sort of artfully control my lift and what pulls down to create sort of a higher frame for my eye. And at my age, you're still really young, but at my age, I find that gravity's winning,
Yeah.
and everything that pulls down tends to win. So for me, it's not frowning. I actually start to look like my eyelids are hooded up again,
Yeah.
and I think, what is wrong? Why do I look tired? What's happening? And that is what makes me do it again.
Okay, to get that lift, which actually I think is a really good lead into another common question is, where do people usually put Botox in their face?
I would say that most people from here up, forehead lines,
Yeah.
frown lines, crow's feet, those are sort of what everyone thinks of for Botox. Other places I use it, and I use it in my patients, fine lines around the lips.
Oh, sure, yeah.
The bands in the neck, the
Yeah, that you
platysmal
get
bands,
those, yeah.
just to tuck those little guys back up again. I use it also in the muscle where it hits my jawline that pulls the corners of my mouth down.
That frown.
Yep, these are all really baby doses. I do have a little of my bunnies.
Yeah, I like the bunnies too.
So otherwise I get these lines in my nose when I smile. And then I started grinding my teeth, and I was cracking the enamel on my teeth, according to my dentist. So I started using it in my masseters,
Yes.
which some people do to shape their face. I'm just doing it medically,
Yeah.
doing it, and it provides a lot of comfort there.
So on average, how much does getting Botox cost?
That totally depends. There is a huge range. I would say the average in Minnesota is probably about 12 to 14. So I tell my patients, I understand that if you go to a Botox party, if you have a friend that just
Yeah.
learned, that you can get it for less
lot less.
expensively, and some people are fine with that. Some people are easy to treat.
Yeah.
It's the people who need a little more refinement or
Yeah.
something a little special done, or who just feel more comfortable
Yeah.
with someone with a little more experience.
Sure. And it goes by essentially, so you're paying $12 to $14, and it goes by units, right?
Correct. And so units are really where the art of it comes in, because as I tell my patients, I'm always trying to do the lowest dose I can to give them the results that they want, because I know they're going to have to do it 3 or 4 times a year.
Yeah.
And quite frankly, there are many things that I would like to do for my patients that will just globally make them feel fresher and look
Yeah.
fresher, and I don't want them to be spending all their money in that one area. So
Yeah.
it's really a balance to come up with a plan for everyone that makes
Yeah.
sense, that's affordable, that allows them to look the way they
Yeah.
wish to look.
So I guess that brings me to my last question, which is something that I hear often, being in my 20s, which is Botox preventative?
So more and more people are using it preventatively. And when this first started happening, I would tell my young patients, why are you doing what? You don't
Yeah.
even have a line there.
Yeah.
And then they started to say, well, in photographs I see it, and in videos I see it. And I started doing really baby doses for those people. And it really does just erase the line.
Sure.
You can leave people with actually quite a bit of movement, especially if they're still young and elastic,
Sure.
and keep them from etching in these deeper lines.
Right.
So if someone comes to me and says they want to do it preventatively, I look at them at full expression.
Sure.
I ask them which lines they're seeing in pictures that they don't like,
Yeah.
and then I'm just really conservatively dosing them.
Yeah.
And people in your age group probably will never have deep inset
yeah.
lines like the rest of us had to backtrack from.
Exactly.
So that is, millennials and men are our largest growing population
Yeah.
of Botox users.
Interesting. With men, that's good to know. Yeah.
I mean, it's nice for them. They're like, well, I have to be in the workforce.
Yeah.
I don't want to look too rugged, or, I want to be taken seriously, and I want people to think I'm relevant.
Yeah. Yeah.
So I'm hearing that more and more from
Interesting.
male patients.
Yeah, and you're just preventing the expression line from getting deeper and deeper over
Yes.
time. Interesting. Yeah. Yeah. Well, thank you so much.
Thanks for having me. This was like a fun first
I
session.
know. I think this was a good first session.
We'll see how this kind of evolves
Yeah,
over time. But
absolutely.
anyway, those are your questions about Botox.
Yay.
We'll see you next time.
See you next time.
Bye-bye.